So today I want to talk about cognitive diffusion technique, part of acceptance and commitment therapy. ACT was developed by American clinical psychologist Dr. Stephen Hayes. This technique has been very helpful for me because I do tend to get stuck in my negative thoughts, and when you believe that thoughts, you can imagine, but that can worsen our mood, and literally you feel stuck in a dark place. And my therapist taught me this life saving technique called cognitive diffusion technique, part of ACT. And then it is about acknowledging and accepting your negative thought without judging and create some space so that your negative thoughts can come and go. And it is common for many people to struggle with negative thoughts, but how we deal with negative thoughts is critical, especially when you struggle with any kind of mental health issues. I had this instant years ago that I met this person for the first time, and I thought to myself, it just this thought came to my mind. She doesn't like me. For me, this thought itself just made me nervous because I believed in it. And this thought and I started to kind of ruminate about this person, then eventually kind of start avoiding this person without even knowing if this person actually disliked me. So I believed in my negative thought, and that created a lot of emotional suffering because of how I cope with my negative thought. So using this cognitive diffusion technique, you learn to acknowledge and accept that your mind is having a negative thought. You even tell yourself, my mind is telling me that this person doesn't like me. Then you create some space between yourself and your negative thought. Instead of fusing with that thought, you diffuse from that thought and just objectively see the thought for what it is. It is just a thought. You're not your thought. By creating some space for this negative thought, it alleviated a lot of emotional suffering in my case. So it was really helpful, and I wanted to introduce this in this video. And another way to deal with this is to use mindfulness technique and another therapy like cognitive behavioral therapy. Replace the thought with a positive statement, essentially avoiding that thought, and we can do that too. But the problem is that you are reinforcing that anxiety, like kind of judging and labeling, oh, that thought shouldn't exist, that thought is dangerous. This thought created by your mind, something that should not exist, something that should be avoided, and something to be afraid of. So for this specific negative thought, CBT was not really helpful. And ACT, cognitive diffusion technique, was very helpful for me, especially when you have this chronic negative thought. It's almost like a theme. For me, again, this person doesn't like me. I'm not likable. It's, I wasn't born with this thought because somebody else taught me and because of my upbringing. I'm not gonna get into that here, but unfortunately, I still hear that voice, and then it was someone else's, but I internalized it as a child, and now I hear that too. But I'm not afraid of it anymore like I used to because I practice this cognitive diffusion technique and just treat that negative thought for what it is and see it for what it is. It is just a thought, and I'm not that thought. Another thing that was helpful was to visualize that I was standing on the bank of a river and see leaves in the stream, leaves on the stream, and I choose one leaf and place this negative thought on the leaf and observe the leaf float away or float off down the stream, and you simply observe this process. After this visualization exercise is done, take a deep breath 3 times. It does take some practice, but I still have to remind myself to do this exercise when I find myself kind of judging random negative thoughts or fusing with these thoughts, and instead I do this exercise and it has helped me. So I wanted to share this in this video. I hope you find this exercise helpful, and if it was, please do like my channel and subscribe. Thank you.